Hello, my name is Dr. Tim Quan with Rheumatology Specialist of Connecticut. I received my medical training at Yale University and have been treating patients with moderate to severe rheumatoid arthritis for the past 11 years. Recently, we've discussed adding a biologic to your current treatment to help relieve pain, stiffness, and swelling of your moderate to severe RA. This is an important step in your rheumatoid arthritis treatment journey, and in making this decision, I encourage you to take the time to consider your options. Learning everything you can about your biologic treatment options, including how they're taken, all safety considerations, and how much they cost may help you feel more confident when deciding on a treatment path. I understand that office visits can be overwhelming, and remembering the information we've discussed can be difficult. So that is why we've created this video. You can now watch this video and consider the different biologic treatment options we've discussed at your own pace in the comfort of your own home and as often as you like. You can also share this video with your family and friends so they can better understand your treatment options. In this video, I will review 5 key elements to think about: the benefits of biologics as a treatment option for rheumatoid arthritis, important safety considerations, the different ways they can be given, affordability and financial considerations associated with these treatment choices, and a few things to think about when considering which available brand options may be right for you. It's important that we work together to determine which treatment fits you and your lifestyle, and this video is designed to help you do that. As you watch this video, use the pad I have given you to write down any important things you'd like to discuss. These could be questions you may have about your treatment options, or thoughts about how a treatment option may work for you. Open and ongoing communication is an important part of an effective treatment plan and can help us meet your treatment goals. First, let's discuss the benefits of biologics. As with other rheumatoid arthritis drugs, biologics do not cure rheumatoid arthritis. Biologics work by helping to relieve pain, stiffness, and swelling in people who have not fully responded to DMARDs, such as methotrexate. Many biologics are taken along with methotrexate. Now let's go over some of the safety considerations with biologics. Biologics are medications that affect your immune system and can cause some serious side effects. We will discuss whether biologic treatment is appropriate for you based on your medical history. Before beginning a biologic, your health will be assessed and you'll be required to have certain tests. We'll talk about which vaccinations you should receive and the best time to receive them. We'll also go over all possible side effects of biologic treatment. Next, I'll review some of the different ways your biologic treatment can be given to you. Depending on the medication, biologic treatments can be administered or given as an IV, also referred to as an infusion, or by self-injection. Receiving an infusion and self-injecting are two very different experiences. Both ways of receiving your biologic medications are for moderate to severe rheumatoid arthritis and deliver the medicine where it needs to be. The decision we will discuss together is which option would best fit your lifestyle. In an IV or infused biologic treatment, these are given in my office. The medication is delivered through a needle that's placed in a vein in your arm, and depending on the medication, the length of the infusion can be 30 minutes to several hours, every 4 weeks or less frequently. Before your infusion, we will check your vital signs and make an accurate health assessment before you receive your treatment. Then the infusion nurse will prepare and give you the infusion. You'll be monitored during and after the treatment. Self-injected biologic treatments is usually done at home after a nurse or I have properly trained you. You will inject the medication under your skin, in your thigh or abdomen. The frequency of injections will depend on the medicine, but the range is usually once a week to once a month. You will receive your treatment in an injection device that's pre-filled with medication and which needs to be stored in your refrigerator and disposed of properly. If a self-injected biologic treatment is right for you, we will make sure that you feel comfortable self-injecting, storing, and disposing the medication, as well as monitoring yourself for signs of infection. Now that we've reviewed 2 different ways to receive your medication, take some time to consider how the different aspects of each option might best fit you and your lifestyle. Affordability is another key consideration when choosing a treatment option. You may have some questions about how you will afford your treatment. The first step you should take is to carefully review your health plan's benefits and explore options for cost support, since coverage requirements and out-of-pocket costs can vary. If you have commercial or private insurance, biologic treatments may be covered under your plan's medical or pharmaceutical benefits, or both. Your costs can vary depending on how your treatment is given. You may also be eligible for out-of-pocket cost support offered by the company that makes your medication. Medical benefits usually cover infused or injected biologic treatments that are given by a healthcare professional. Pharmacy benefits usually cover biologic treatments that you inject yourself. If you have Medicare, biologic treatments may be covered under Medicare Part B or Part D. Your costs can vary depending on how your treatment is given. If you need supplemental assistance, there are foundations that may be able to help you. Medicare Part B usually covers infused or injected biologic treatments that are given by a healthcare professional. Medicare Part D usually covers biologic treatments that you inject yourself. If you do not have health insurance, you may find help through a private foundation. The affordability and financial considerations of treatment options can be a lot of information to digest. My office can assist you with questions about your financial options. So far, we've reviewed the benefits of biologics and their safety considerations, the IV or infusion experience, the self-injection experience, and some financial considerations associated with biologic treatment. Our final consideration is which of the biologic brand options may be right for you. Together we will discuss the available brands and make a decision based on our shared knowledge of your condition, general health, preference, and health plan coverage. Moderate to severe rheumatoid arthritis is a chronic and progressive disease that requires frequent monitoring and a long-term commitment to taking medicine. That's why it's important that we work together to find a biologic treatment for your rheumatoid arthritis that you are comfortable with and that you can consistently and successfully follow to help manage your condition. As you think about what we've discussed in this video, it may be helpful to ask yourself the following questions. How often is treatment given? How many infusions or injections are there per year? How long will my IV or infusion treatment take? How long will my self-injection take? Will the self-injection medication be delivered to my home, and how will I store it? Will this treatment be covered by my insurance? How will I pay for it? Is there a support program that I can turn to if I have questions or need someone to talk to? Thank you for taking the time to watch this video. Remember, the more you know, the better prepared you'll be to manage your rheumatoid arthritis. I hope this video has provided you with some helpful information as you consider your treatment options. You may also want to check the additional resources section of this video for a listing of organizations that may assist you in learning more about rheumatoid arthritis, different ways to connect with people living with RA, as well as RA advocacy groups dedicated to helping people like you. I look forward to continuing our discussions and sharing this important decisions with you.